I've noticed in the past, this kidney has really been affecting the country and I guess the world. So I've decided to take a stand and come out with the Kidney Association and do the work.
Okay, do you know anybody that has the disease or related to anybody?
Yeah, quite a number. Even in my family, people has passed on, due to kidney failure and, stuff like that. So yes,
Okay, so it's a little personal for you.
very, very personal.
My grandfather died of renal failure in 2012, and I had a first cousin who is suffering from renal failure at this point in time, who is 19 years old. She's doing dialysis at this point in time, and we try to assist us as much as possible also. So it's prevalent in my family, and because of that, I've kind of find it important to try to bring awareness and try to prevent the disease as much as possible.
For these two men and the hundreds of men and women who joined them at the Sancas Plaza under inclement skies on this Saturday morning, kidney disease is personal. Discomfort and pain attached to losing this most valuable of organs is not one to be visited on anyone, although kidney disease is fast moving up the ranks as a leading cause of death in Belize. Medical officer for Matron Roberts Clinic, Mariana Ancona, says that diabetics and hypertensive are most in the line of fire, but we should all learn to be moderate about what we eat.
You don't have to know your risk. Are you at risk for being diabetic and hypertensive? And if you are, you can prevent it from happening. You need to eat healthy and come out and exercise. Nothing fancy, just get out there.
Okay, any particular foods, water, that kind of thing?
It's a long list, but you keep it simple. You eat a little bit of everything. Keep the stuff you know you shouldn't eat low, and then we have services at the clinic. We have a nutritionist, that's her job. She sits and she teaches you how to eat and how much.
The men and women of the Coast Guard must keep physically fit to answer the challenges of their unique jobs as defenders of Belize's coast and seas. But 25 of them came out to participate in the walk. Their leader, Lieutenant Junior Grade David Ayala, says they will work with the association to spread the message of attention to physical health.
Well, physical is a very important aspect in the Coast Guard. Actually, from our commandant, we have moved from doing physical trainings from 2 times a week to actually having it 5 times a week, right? So we do it daily. It is very important due to the fact of the nature of our job, right? Very physically demanding, and therefore we try our best to keep up with the physical standards as much as possible. We will have some of the members of the Kidney Association that have visited my office, whereby we have tried to collaborate as much as possible in their events. And so definitely that is something that we are considering. So it is more dialogue and more planning that needs to be taken.
For those staring death and dysfunction in the face, the funds raised at today's walk to get them help will go a long way.
Well, we mainly assist those patients who do dialysis at Belize Healthcare Partners and Dialysis de Belize. We know that there's a program at called Houston Memorial Hospital and at Lomaluz. For those who are not on the program, they tend to find it difficult to meet payments for dialysis. And they normally come to us and we try to assist them as much as possible in regards to having them do their dialysis on a weekly basis. They normally have to do 3 a week. Some of them do 2, some of them do 1. All depends on what they could afford. We try to assist them as much as possible, but we only could assist as much as our funds would actually allow us to.
Okay, can you say how many get assistance?
Well, we have about 22 at Dialysis de Belize. We don't assist all of them, but for those that come to us, we normally would assist them. On a weekly basis, we have about 3 come to us, and we try to assist them as much as possible.
Reporting for News 5, I'm Andra Polanco.